Okay, this is going to be a presentation on inherited cardiac arrhythmias. And so the objectives include to list the genes associated with prolonged QT syndrome, identify the inheritance pattern along QT, and recognize clues in a family history for possible long QT, including intrauterine fetal demise or IUFD, sudden infant death syndrome or SIDS, and just in general sudden death, even if you're not an infant. So, sudden cardiac death is the most common cause of death in adults under the age of 65. 50 to 60% of these sudden deaths are cardiovascular in origin. Causes of sudden cardiac death include cardiomyopathy, enlargement of the heart, arrhythmia, and aortopathy. And we're going to discuss aortopathy when we get to connective tissue. Sudden cardiac death, unfortunately, can be one of the first symptoms of these disorders. And that's a bad symptom. So, arrhythmias, including long QT, the problem is the transport of ions in and out of the cell. And so the ions that we're primarily talking about include sodium, potassium, calcium, and chloride. And the movement of these ions are involved in the electrical stimulation of the heartbeat. Defects in these channels can lead to poor ion channel functioning, which can lead to abnormal signaling. But they can also work too fast. So here we have the normal QT interval. If I can get my mouse to work, which I can't. So we measure this, and here's the QRS complex, and then the T wave, and then here we have the next one. If this is too long, sometimes the heart forgets to keep beating. And this can result in an abnormal rhythm that it can skip beats. So long QT syndrome is just the arrhythmia, nothing else. Symptoms include syncope, palpitations, cardiac arrest, sudden cardiac death. Over 30% of patients are asymptomatic. So, like I said, they're asymptomatic, an EKG is normal, they have no symptoms, and this sudden cardiac death could be the first one. Expanded family history is important for diagnosis. Onset of symptoms range from 9 to 20, but can occur from intrauterine to the 70s or 80s. It's inherited in dominant fashion. That means you only need one copy of this gene that's not working to have the symptoms. And it's about 1 in 3,000 to 1 in 7,000 individuals. The most common mutation related to long QT have to do with 3 gene locate. And we've started naming things better. So LQT1, long QT, the first gene that we found, long QT, the second gene we found, and long QT, the third. LQT1 and LQT2 are also known as the genes KCNH2 or KCNQ1, and these are potassium channels. And then LQT3 is caused by a sodium channel, SCN5A. Mutations of the LQT1 are the least hazardous, with a 30% probability of a cardiac event by age 40. Not all individuals with long QT have an abnormal EKG, and this is actually very important. Genetic testing is the only way we can be certain if they have this or not. I know this is a busy slide, but it's actually a really important one. And you see this person swimming, and the reason they show this is swimming can be a precipitator to a cardiac event. And so some of the things that can happen include syncope, seizures, and sudden death. But if you faint or you have a syncopal episode in a pool or a lake, you end up at the bottom, and by the time they find you, they can't resuscitate you. So one of the clues of like a long QT is that you hear a story of somebody who was in a swimming pool at a party, and all of a sudden, where's Johnny? And he's at the bottom of the lake, the bottom of the pool. Or, we're not talking about going out in Lake Michigan when the red flags are out, but just, being out in Lake Michigan and swimming around. Somebody's a good swimmer. Another clue is somebody who got in a single car accident. It wasn't raining, it wasn't snowing, and their car hit a tree and they died. But the question is, did they die and then the car hit the tree? Did their heart stop and then the car hit the tree? So when you hear about a teenager, there's a family history of a 17-year-old who died. His car hit the tree. He wasn't drunk. No other reason why that happened. This could be a clue looking at a family history. So the LQT3, as I said, is a sodium channel SCN5A. When there's a gain of function of this transport of sodium, that is known as LQT3 or long QT3. When there's a loss of function of the transport of the sodium, that's known as Brugada syndrome, which results in idiopathic ventricular fibrillation, progressive conductive disease, and congenital sick sinus. So it's actually worse for it to be too slow than too fast. On the flip side, the KCNQ1 is associated with long QT1, and that's a loss of function. Gain of function is a short QT, and then the KCNH2, which results in long QT2. Loss of function is long QT. Gain of function, again, is short QT. This is actually a very large family that I saw a number of years ago. And the person that presented to clinic was a 63-year-old that was recently identified with a rhythm abnormality known as long QT, and we did genetic testing and identified a gene mutation. But when you look at this family history, his sister died at 75, and she had a history of long QT, and that's why we were concerned when he had an arrhythmia too. But there were a number of people still, this person died of some type of cardiac event. This individual is 78 years old, alive and healthy, but had a daughter who died at 30 of a sudden death. And also she had a child that died of SIDS at 15 months. Had a son who's 50 and fine, but had a daughter that died in her sleep at 26. This individual is 75 and had a 23-year-old that died a sudden death. So when you look at this family history, it's an incredibly large family, but it wasn't unusual to be going to a funeral of somebody in their 20s that just died in their sleep. And that's not normal. And so, when you actually look at these large family histories, you see clues that people were like, well, that just happens in my family. Well, again, not everybody that carries the long QT has symptoms, but they can pass it on, and those individuals could have symptoms. Jervell-Lange-Nielsen is an uncommon form of long QT, and it's an inherited autosomal recessive. That means both copies have to be non-functional to have it. In addition to the long QT, the patients also have sensory nerve hearing loss. So the regular long QT, it's just long QT, nothing else. But in this case, and then there's changes in the potassium channels, KCNQ1 or KCNE1. You might notice that KCNQ1 is dominant long QT, but if both copies aren't working, it can result in long QT and hearing loss. So treatment, beta blockers are effective to prevent symptoms. Numerous medications can precipitate a rhythm disturbance. These include antihistamines, erythromycin, Bactrim, and many antipsychotic medications, as well as antifungals. And the diagnosis of long QT prior to symptoms, which can be sudden death, is really important. And so when you have a family history, the only way to figure this out is genetic testing. And EKG is not enough because 30% of patients do not have an abnormality in the EKG. So abnormalities in one of these genes that are involved in the transport of sodium and potassium in the cardiac cells can result in long QT on EKG. Clues in the family history of an arrhythmia and inherited arrhythmia include late-term pregnancy losses. The baby's heart stopped beating in utero. Sudden infant death. Sudden death during adulthood, including, again, single car accidents, drowning, and just dying in their sleep. Genetic testing should be performed on anyone with a sudden death or prenatal to adulthood looking for this possible diagnosis. It's important if I identify somebody with long QT that I test them first, and then I can test other family members for that same change in the gene, even if they have a normal EKG. So this is a question that I took from one of those USMLE books. Again, I always argue these are not refereed questions, but a 6-year-old is born with deafness and presents to the emergency room after collapsing at home. He was running after one of his 3 siblings when he turned pale and fell to the floor. His parents dialed 911. He subsequently recovered in the ambulance. In the ER, he appeared pale. The parents are concerned and state that the boy is not taking any medication. An electrocardiogram is performed revealing long QT and abnormal T waves. Within a minute, the patient loses consciousness. The echocardiogram reveals an irregular polymorphic ventricular tachycardia that appears undulated in isoelectric line. What is the most likely diagnosis? Jervell-Lange-Nielsen syndrome, Romano-Ward, von Hippel-Lindau, or Wolff-Parkinson-White. So Romano-Ward is another name for long QT syndrome. Von Hippel-Lindau is a different disorder we'll talk about. Wolff-Parkinson-White is a specific cardiac abnormality. But this patient not only had long QT, but he also had hearing loss. So the correct answer is Jervell-Lange-Nielsen syndrome. So that concludes this presentation.